Thanks so much for staying with us on SABC News. The National Assembly has passed the National Health Insurance Bill. The NHI, through its fund, are set up to, according to government, cover South Africans of all races, rich or poor, and legal long-term residents as well. So how they envisage it is that there will be one pool of healthcare funding for private and public healthcare providers alike. And when people go to these healthcare facilities or centres, there will be no fees charged because the NHI fund will cover the costs of people's medical care in the same way that medical aids now do for their members. Prelisha Singh, who is a partner at Weber Wenzel, joins me. Thanks so much for your time on SABC News this afternoon. Just talk to me about your reaction to the bill in general and the objectives of the NHI before we get into the details of it.
Great. Now, thank you, Nzinga, and good afternoon. This bill has been a long time coming. Its inception, I think, commenced roughly in 2010. And so we have seen various iterations of the bill over the past 13 years. We were not surprised by the passage and timing of the passage of the bill now, but we believe that the bill, unfortunately, and notwithstanding such a long history of consideration, is wanting in several material respects. I wish to say up front that the accessibility of universal healthcare and quality healthcare is a laudable and a necessary goal. And so we are in support of the underpinnings, at least at the level of principle of the bill. Our concern, however, lies in the formulation as well as the hurdles we believe in the implementation of the bill.
All right, so you've spoken about concerns around the collection of the funds to fund that program. What's the concern with the way that legislation is worded currently when it comes to that funding?
Well, the fund, there's no real concern insofar as the concept of a national fund, which is intended to purchase healthcare services from accredited providers. The wording in the bill is broad, seeing as it's intended to be framework legislation. Our concern lies more in the implementation and what is then left wanting, or rather unknown, in the formulation. So the fund is intended to be the single purchaser of healthcare products for the citizenry. And as you mentioned earlier, it will include those who are residents and those who do not hold citizenship in the country. The concern lies with what will make up that funding, because that is not made clear in the bill at the level of the necessary detail, and then how that funding is actually going to be dispersed. There are hints in the bill in relation to the pillars of funding, and that it will come from, for example, a redistribution of parliamentary appropriation. But then there's other wording that leaves one a little confused insofar as there being a payroll tax and a particular surcharge. And it's then not clear how we're going to reconcile the appropriation with this additional tax, when it might be levied, and at what rate.
Medical aids are also questioning their role. That bill seems to say that their work will be complementary. So what ramifications does that have for medical aids and also their rights? You've spoken in an article that you've written about their property and other rights when it comes to this bill.
Thanks, Nzinga. The concern lies with, I think, the first point I'd raised, being that it's framework legislation and a lot is left to what would be in further regulations, and how then that is going to impact the citizenry, the private sector providers, and most importantly, the medical schemes. The complementary role reserved for medical schemes is most unknown, seeing as we are not yet aware of the benefit package that will indeed be covered by the NHI. So it leaves one quite uncertain as to the future of medical schemes. If you are intended to serve only a complementary role, it is hard for you to ascertain what would be your role if you don't understand what is the primary. And whilst the primary is intended to be quite a comprehensive set of benefits, it then suggests that what will then be left to medical schemes would be dramatically reduced and might actually threaten survival if they are only to be a top-up or additional healthcare provider or funder. And we hinted in our article written by a few of our Webber Wentzel partners in our healthcare sector that we believe that there is or could potentially be a constitutional challenge that would rest on property rights, the right to trade and profession, right of access to healthcare, given that we are, at least at the level of concept in the bill, concerned that it might threaten the survival of the medical schemes as currently contained in the Medical Schemes Act, seeing as the bill itself, if you look at the end, aims to amend significant tracks of the Medical Schemes Act.
Prelisha, you've raised this concern in that article, and it's something that other people have raised as well about the speed, right? People are saying the speed at which this has been done, but you also pointed out that since around 2010, that's been there. Dr. Aaron Motsoaledi, when he was still health minister, said that it's something that's been in the works since 2007. They've had consultations with Treasury and the presidency numerous times, and it's happening. So there seem to be there's the kind of a really big concern on the one hand from a lot of the private sector companies, and then government is saying this thing is happening, this thing is going to even out the scales. The healthcare in South Africa is so unbalanced. Where do you meet in the middle, and how do you meet in the middle?
Well, we touched on it at least at a high level in the article. One such, suggestion, and the thing with making of law is that you might not necessarily agree with it, but we still believe that it must be good law and it must be constitutional law, is that at least practically some of the funding and the thinking around the use of the funding could have been channeled directly to an upgrade or enhancement of the public healthcare system. We are a country with huge disparity. And then I started to say that, the underpinnings and the objectives are laudable. But what you want to try to achieve in this, through this legislative mechanism, we believe is a bit too extreme, where there could have been other impactful mechanisms that could have done effectively that, up the quality at the public healthcare system, as opposed to almost erode the entire system, or potentially erode the entire system.
Well, we'll see what will happen. Thanks so much for your time on SABC News this afternoon. Prelisha Singh, a partner at Webber Wentzel, just joining us, speaking about the NHI, what could happen, and concerns about different parts of that law. It's a story that's unfolding, and we will follow here on Point.